This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic. Welcome to the Grow My Clinic podcast. It's fantastic to be back in your earbuds again. My name is Jack O'Brien from Clinic Mastery, and today we have a very special guest. We have Ryan Savitz. Ryan, how are you today, mate?
Yeah, very well, thank you. How are you going?
I'm doing well. So for those who aren't familiar, Ryan works for DJO Global, commonly known as DonJoy. But as I've just learned, DJO Global is the global manufacturer for brands like DonJoy, Aircast, Chattanooga, a bunch of different brands. So commonly known as DonJoy, but Ryan works for DJO Global as the product manager, one of the product managers. So Ryan, today we're going to talk a little bit about products and how they can enhance the client experience within a health clinic environment. So this could be a can of worms. This could end up anywhere and everywhere. We're going to have a little bit of fun. But first of all, can you let us know, how did you end up working at DJO Global, and what's your background, your credentials? Why should we trust you?
Sure. So my background, I studied a combined mechanical and master's in biomedical engineering. And I was working as an engineer, but soon found I was more interested in delivering those products to market. And so I joined DJO as the service and repairs coordinator. So I learned about all the after sales side of selling equipment and how important it is. And then I sort of transitioned into, basically demonstrating the product to the customers, teaching them how to use them, and sort of growing the different brands. Specifically focusing on the Chattanooga brand, which is, things like shockwave, laser, ultrasound, treatment tables and all that. Basically I formed this product manager role where I go out and train our clients on how to use this equipment and how to, enhance their client experience by incorporating these great products.
Fascinating. And I guess having that, correct me if I'm wrong, but having that biomedical engineering background kind of fits perfectly in understanding the anatomy and physiology, the biomechanics, as well as the engineering side of the products, right?
Yeah, no, it's good. It definitely helps. I love technology. I love products. So, it's great. It makes it easy to explain it. But I think it's important, often people get caught up in the complexities and how these things work. I like to my approach is always to keep it simple, especially when explaining complex ideas. I imagine it's similar for some of your clients when they're trying to explain, a complex condition to a patient. My idea is always sort of explain it to someone in their own words. And sure. I try to do that with the products as well.
Okay. All right. So a little bit more context for us. Can you tell us briefly about DJO Global? If it's not just DonJoy, then what the heck do you guys do?
Yeah, good question. So DJO Global, we're actually now called DJO, but DJO is a global manufacturer. We manufacture brands Aircast, Chattanooga, DonJoy, Compex, Dr. Comfort, number of brands. It's all manufactured overseas, but locally we are the distribution in Australia and New Zealand. And the products are, we're basically the number one sports medicine company in the world. We do have an implant side of the business, but we're very much big into the rehab side in the orthopedic space.
Sure. And I think, over the last couple of years, my clinic personally uses a lot of DonJoy or DJO suppliers. And initially, as I'm sure most listeners potentially would assume, that DJO just supplies DonJoy gear, but it extends beyond that, right, into consumables and exercise gear, as well as the high-end technology stuff.
Yeah, that's right. So locally, we know that, local practitioners like to order a range of different products. So we've now got basically a full catalog with all sorts of things. You can get foam rollers from us, you can get your sports tape, as well as, the high-end equipment, plus all your bracing, whether it's high-end bracing for ACL injuries and we've also got equipment for speech therapists as well, new Vital Stim Plus technology, or bracing, or just, everyday sort of bracing like an ankle brace, or, knee brace, things like that.
Sure. Okay, well, enough about DJO. Let's talk about us and clinic owners and how we can utilize products to enhance the client experience. You just touched on the speech therapy technology there, which is fascinating to me. Can you maybe give us a couple of stories, not so much about the products, but how clinics have incorporated new tech to improve the service offering and the experience for their patients?
Sure. So, we'll start with that one. so there's a condition, swallowing disorders that some patients can have in the speech therapy world. And we have a product which is great. It's called VitalStim Plus. It's essentially using electrical muscle stimulation combined with biofeedback to help retrain the swallowing, to retrain those muscles. And it's great because, patients, first of all, there's clinicals to prove that it works, but it actually is a really good experience for the patient. They can visually see, how their muscles are contracting. They can see how they're improving. So that's great. Yeah. In the sort of rehab world of pain relief and all that, we're looking at things like shockwave. I mean, shockwave's a great example where shockwave therapy used to treat chronic tendinopathies. You can also use it for, myofascial pain and that. But, it's a great example where people are coming to clinics these days looking to get their problems resolved. They're looking, first of all, for, you to solve their problem, whether it's pain relief or whether it's a chronic condition. Mm-hmm. And something like shockwave is a great device. First of all, it's proven to work in that, you get sort of that instant pain relief. So the patient's going to walk out feeling great. And then looking at the physio world or chiro, osteo, podiatry world, something like shockwave has been a great device to help improve client experience. First of all, clients, they do their research online. They'll look at these different technologies that are out there. And I've heard experiences of clinicians telling me that patients have called them asking, do you have shockwave therapy? Because I've got plantar fasciitis.
Right. Okay. That's interesting, isn't it? How our patients are doing the research and they're telling us what treatments we should provide. Now, there'll be a train of thought that says I'm the clinician and I should be deciding what patient treatments are necessary. But this is the reality of 2018 at the time of this recording, that patients are Googling and requesting things like shockwave. Sorry to interrupt.
Yeah, no, exactly. And that's, you need to, as a clinician, you need to be at the forefront of that. So you need to know that, these technologies are out there. DJO, our responsibility is to let you guys know that these things are out there and provide you with the education and support to bring them to your patients. But all the clinics that have them, their patients, and that's just one example, but, all clinics that do adopt this technology, patients love it. They tell their friends, they tell their families. Have you heard about this miracle machine? Mm-hmm. Yeah, it does give that, and shockwave is great. It does give that instant pain relief, but it also is something that's treating the root cause. Yeah. And the other important thing is that they come into your consultation room and they see that you've got this piece of equipment there. That adds so much more value to your consultation because, they're seeing that, first of all, we don't promote shockwave as a standalone device. We promote it as an adjunct. So, you'll be using, manual therapies or other modalities, but just by combining something like shockwave or another device, laser, for example, in that consult will just add a lot more value to your consultation, and clients will feel like they've got a better outcome. And again, they'll tell their friends, tell their family about this machine.
Right. Totally. Yeah. And having that machine, that piece of technology, essentially gives your brand or your clinic credibility, right? One of our founders, Daniel Gibbs, serves high-end quality herbal tea in their welcome room, or what most people would call a waiting room. And the comments from some of the patients that sit in the welcome room or even the tea supplier are things like, wow, if you serve this brand of tea, you must be really good podiatrists. Obviously tea's got nothing to do with being a good podiatrist, but it's a similar element when it comes to what products or what machines that we carry and provide. It gives us certain credibility and trust with your brand. Can I look back to the VitalStim when it comes to speech path? Not specifically that one, but you mentioned things like biofeedback and why that's really important for the client experience. Can you speak a little bit more into that and how products can give some more information, maybe whether it's sensory or whether it's some data? I know there's different exercise equipment out there that can provide a bit more data, but what does that mean for the clients, for the patients, when they've got products that can provide data?
Yeah, so I think it's a good question. I think the big thing there when I think about feedback or data is basically increasing your patient adherence to their rehab. So, people want to know that they're getting better. They want to see improvement, right? Whether, any sort of injury, they want to know they're getting, from A to B, and you're helping them along the way. But having technology, we have a machine, so it's called the Huber. It's a great exercise machine, but it's not just an exercise machine. It's got data. So it gives you quantitative data to show the patient how they've improved from day 1 through all the way to the end of their treatment, and they can see, and they love it. The patients love it. The other thing it does is, it's enjoyable for the patient to actually come into your clinic and exercise on that machine, which again is increasing that patient adherence to rehab. Whether looking at the biofeedback side, whether it's recovering from an ACL surgery or whether it's your swallowing muscles, again, that's your body. You can actually record your muscle movement, your muscle contraction on a machine, and that can be visually displayed back to the patient. Now, for a patient to see that visually is great for them. They can actually see as they contract their muscles or swallow, contracting their swallowing muscles.
So not too dissimilar to real-time ultrasound, right?
Yeah, exactly. So exactly, real-time ultrasound, another great example. And these are all things that can really add to the consultation because it's basically giving that patient feedback. They're going to see they're getting better, from day 1, to day 10 or day 20, whenever it is.
Mm-hmm.
And it's going to help them get a better outcome.
Okay, brilliant. Now we let's poke the bear a little bit when it comes to things like shockwave, or what we're going to do is we're going to loop back to some of the consumables and exercise products. But let's talk about the big fancy tech stuff, things like shockwave. You mentioned at the top, therapeutic ultrasound and laser interferential, all this sort of stuff. But let's talk about shockwave specifically. You mentioned that it works. Now, when I went through university, we were taught that it doesn't really work, or it didn't work at the time. Can you speak a little bit more into some of the evidence? We're not here, this isn't a clinical podcast, okay? So we're not talking about the evidence, whether it works or not. But can you just touch a little bit on the changing trends in evidence and how the right product supplier can help clinic owners keep on top of that?
Definitely. So look, DJO, as I said before, we're a global manufacturer. So all the products that we put out, we want to make sure they're all clinically proven. Where Shockwave, the machine that we provide, has got clinical studies on it. Laser, same thing. So look, the studies, I think as a practitioner, the first thing that you need to do is stay on top with the latest research. We can provide that. We do that with we do that through multiple different ways. We have education courses, we have education nights, and we have, regular emails that we send out weekly or monthly, depending if you subscribe. But so first of all, it's important to stay up to date with the research because it does change. And
sure.
Shockwave is a good example where there is so much research out there at the moment which shows that it works. But like you said, putting clinicals aside, I think the anecdotal evidence is something that needs to be taken into account. And when I say that, I've now been a DJO for about 5 years, and I've worked with a lot of different practitioners, ranging from different sort of practitioners. And it's amazing when you can, once you install that device in a clinic and can see how they've used it, the feedback that they give you on how the device has helped with different conditions is amazing. And obviously, I understand that everyone wants to value that, they want to provide evidence-based practice, which, it is. But I think, what's interesting to see is when someone does take on something like Shockwave, they start to use it for different conditions because the patients ask them to use it on those conditions.
Sure.
They're not, I guess, pushing the boundary. They're still using it within the realm of what it's designed to be used for.
Mm-hmm.
But it's just amazing to see that the results that they get. So when we talk about evidence, I think it's important to take into account clinical and anecdotal evidence. And then your second question was, make sure that you are purchasing from a reliable supplier. So, obviously I think you need to ask, the question to your supplier, is their machine clinically proven? Can they provide, good after-sales service? Are they going to hold on to this device as a distributor? If they're just a distributor, are they going to drop this device next year and then sell something else?
Sure.
You need to be asking these questions because I think one of the things that we do well is providing that after-sales service. I think these are things that you need to take into account when you're making that decision.
Okay. And I think it's an important point that we put clinicals aside, and at least for the purposes of this podcast, I think what you'd find, Ryan, is that listeners to the Grow My Clinic podcast are fairly open-minded, and there's many different approaches and philosophies, but we're all here to create better outcomes and experiences for our patients in a way that is meaningful for them. So can you speak a little bit about some of those pain management modalities, things like interferential and TENS, which we know, like everyone knows, that's not going to make anyone better. It's not going to fix the underlying problems, but is there still a place for them? And have you got examples of clinics that are using these in ways that patients love?
Yeah, Good question. So yeah, in terms of obviously with our modalities, there are some that, are just used to really treat that acute pain management. Others are used to treat the chronic conditions and treat the root cause.
Sure.
Shockwave obviously being that example. But when you're looking at something like interferential and TENS, we have great examples. I'll give you another example with one client that recently upgraded their clinic, right? And they've been using interferential for a long time, but they decided to upgrade the clinic and have, they've got 5 rooms where patients come in and get treated face-to-face by the clinicians for maybe say the first 10 minutes, 15 minutes. And then they lie on the bed and have interferential for about 20 minutes. And they love that. They come back week after week, and that's what they love. So look, the reason why they love it, because, it feels good, helps their pain. They feel like they've got more value out of the consult. We're not go out saying that that's necessarily fixing the problem.
Sure.
But I think it's important to realize that your patients actually value having these options, and that's the key thing. Having the tech gives you different options to show the patient. Give them the option, let them decide what they want, whether it's product, whether it's an item that you're offering to sell to them, whether it's a technology that you want to use, to treat them. So that was probably a good example where displaying that thing of using interferential in clinic.
Yeah, and you're right. As long as we're not we're misleading patients, as long as we're not saying this is going to fix you or cure you, if patients are well informed around the temporary relief but lack of ongoing solutions, and yet they still choose that, some would see that as true patient-centered care and how technology can really complement what happens in a manual or hands-on environment. Let's change tact a little bit. I'm going to grill you a little bit, grill the doctor, so to speak. And what should clinics be looking for when choosing a supplier? What is it that differentiates one supplier from another, and why would we choose a certain supplier over another?
Okay, yeah. So I think first thing is obviously product, right? Having good quality product.
Sure.
That's probably the first thing that you're offering. At the end of the day, you're then on selling that product to your patients, to your clients. So you want to be able to make sure that they're getting a good quality product,
sure,
which will last. So I think having choosing a supplier that supplies quality products, good brands is great. Second thing is in our environment, in a clinical environment, having a supplier that has clinical support, whether it's your salesperson or whether they offer clinical education, whether fortnightly or quarterly, once a year, whatever it is. But having a supplier that offers that education is important. Obviously, good customer service, customer experience is important. So, allowing you to order seamlessly online, getting your product next day if you need it, things like that. You tell me. You've been a practitioner. What did you think?
Well, the tables have turned. We were looking for suppliers that was essentially a one-stop shop almost as much as possible. We know it's tricky to find a retailer or a supplier that supplies everything, but we're pretty happy that we've found something where we can get 90% or more of our stuff from. That online option was really important, and shipping times, like in a clinic environment, and this would be one I'd be interested to get your thoughts on, but we want to carry as little stock as necessary, right? We don't need to have thousands and thousands of dollars sitting on our shelves. So it was important for us to find a supplier that would deliver, maybe same day or next day with good shipping options. We know that shipping can be really expensive, so we've found a solution with great shipping options. And then thirdly was a personal relationship with your contact there, with your sales rep. I know our guy looks after us, and there's all sorts of different discounts coming and opportunities and bulk buy options. So they were the things that were really important for me. And so by an extension of that question, what types of products should people carry? What are some of the mistakes that clinics make when managing stock, carrying too much, different ranges? What are your thoughts around that?
Yeah, look, you touched there on having as minimal stock as you can. It's interesting because, prior to this job, in my university days, I had a job working at Harvey Norman in retail and toy stores. So you learn a lot about merchandising in retail. And I think it's a good lesson for practitioners to learn. If you want to be able to sell product in your clinic, you've got to have it there. You've got to have it in front of the patients. They can see
Sure.
it. It's just basic lesson of retail merchandising. That's why you'll see when you walk into a retail shop, they might have 10 items stacked on top of each other, so just to make it aware that you have it. So I think, look, definitely having a supplier that gives you next day shipping is important. I know, you get the patient that comes in and they have, the odd brace that you need to order. So being able to get that next day is important. But in terms of stocking, I guess the things that you should, everyone's got different ways they want to run their clinic, but we have a sort of a top 25 list that sort of people that we find clinics, like to use. Things like pillows, walkers.
Sure.
It's a popular one. Basic TENS machines are great. These are things that, almost every day there's going to be someone coming in and they're going to need. So I think, just making sure you've got minimum stock levels of that. It's always a tricky one, stock. But like I said, as long as you've got enough, in the different sizes, we have some items that have universal sizes. That obviously makes it easier to keep stock.
Absolutely.
But things like boots, obviously, there's no universal size. You need to have, small, medium, large, different pages. That's probably a popular one. So just make sure you don't run out of those.
Okay.
But on that point, I guess, I think the important thing is with product, if you have it there, your clients, they've come in there and they trust you. They trust what you say.
Oh, great. Exactly.
So, they're trusting you with your advice on, what exercises to do on your rehab program and all that. But I think the mistake a lot of clinicians make is they don't realize that their patients will actually trust them with them providing a guidance on what products to use. So often, we have practitioners say to us, they'll go to the local chemist and buy this brace. Well, actually, they're in your clinic, and if you advise them on what the best brace to use, they'll trust you.
Sure.
They'll get a better product. They'll get a better outcome because the product's a good quality product. And, you can provide that extra service of fitting it for them, explain them how to use it, whether it's a brace, whether it's, a foam roller, things like that. So just don't underestimate, that the trust they have in you. And the same applies to product, not just, the advice you give them.
Yeah, totally. And I think that's a real value add. I think a lot of clinics feel the pressure to, price match the local chemist or even the local Big W or Kmart that sells a lot of the equipment. But patients value that expert advice, that expert opinion, and also convenience to come out of a consult and be prescribed an aid that, if done in the context of a consult, may attract different GST regulations, which is an important point to consider whether you can charge GST inside or outside a consult. Patients value that. That's really important. Ryan, can you share with us, maybe as we look towards wrapping up, maybe one or two more stories of clinics that have done innovative, new things that help improve the client experience?
Yeah, okay. Look, well, the more recent one, just think of it, is the Huber, the new Chattanooga Huber.
So explain a bit more about the Huber. What is this thing?
Yeah. So the Huber is a neuromuscular rehab and assessment device. So people look at it and they're like, oh, it's a vibration platform. Well, no, it's definitely not. And or they might say it's a wobble board on steroids. Right. But essentially it's an exercise machine. It's got sensors in the platform and the handle, and there's a screen that you look at. And basically, you do an assessment, you work out, where the patient's at, things like, unipodal test, rhomboid test, different things. Get an assessment of where they're at. You combine that with other assessments we've done, and then as a practitioner, you prescribe them exercises to do on the machine. Right?
Okay, sure. Which provide resistance or balance, those sorts of things.
Yeah, that's right. So you're doing balance training, all that. And there was a clinic that's recently taken this on board, and we did just been out and did some filming of them to get an understanding on how they're using it. And it was just amazing. We interviewed 3 of their patients, all different conditions. One of them suffered from mini strokes, so had just problems sitting down. Another one had a recent hip operation. Another one just had back pain. And all 3 of them, it was just amazing to see how often they came back in to use this machine in clinic. And we also looked at the data that the machine gives you and how they've improved. And They're all impressed in how they've improved over time. So, that's a good example where, these guys are just, in love with the machine, love the practitioner, obviously, because they've, allowed them to use this machine. Yeah. Sure. So, that's a good example.
I love it.
Yeah. Another example, I guess on the brace on the brace fitting sides.
Sure.
I have another client whereby one of the services we offer is going out to clinics and doing high-end brace fitting. So if you've got patients with an ACL injury or osteoarthritis, and they want to go back to, and they want to wear a brace, right? So we come out, fit the brace. This particular practitioner has a force plate in their clinic. They also have cameras, and they can actually work out the knee varus and valgus angle. So what they do is they give the patient, they show the patient what the angle is before putting the brace. We then put on the brace, and they can see instantly that it's, adjusted their angle, So,
right.
Yeah, look, I mean, obviously some of these braces they don't work necessarily instantly, but the fact that the patient can see an instant result from, incorporating that technology, just makes them feeling great after the consult. They've got a better experience. They're more comfortable with purchasing this brace because they know it's going to help them. They've had an overall good experience at the clinic, by engaging with both, the practitioner and then also, bringing in the supplier's, brace fitting service as well. So
yeah, we've had an example or an experience similar to that where we've been able to involve the supplier, our DJO rep, and make sure something's custom fitted. Again, patients feel like they're cared for. They're not just another number in a production line that gets a generic brace, but they get something that is customized and appropriate for them to return back to what they want to do. That's an experience that sets you apart from the clinic down the road that just churns through, repackaged generic braces or products without naming names. You get to provide an experience that's over and above for patients. Ryan, that's been really useful. I think I'm sure practitioners and clinic owners will be really interested in some of those ways to manage stock, incorporate big tech, and look at the range of how to choose a supplier and what's important when it comes to incorporating products into creating amazing experiences. Now, if people want to learn any more about DJO specifically, are you global? Because we have listeners across the UK, the US, New Zealand, or how do people get in touch with you?
Sure. So you can go to the corporate website, djoglobal.com, to access all information about the product. If you're local, whether you're in Australia or New Zealand, we have a local website, djostore.com.au, or australia.co.nz for New Zealand. You can find all information there, how to sign up for an account. You can see our blog posts, our upcoming education events, and obviously search through our product catalog.
Yeah, that's fantastic. And I think that's been a real eye-opener for me, is the education around products, around rehab, even around things like business tips and skills where we can work together a little bit more. I'm really appreciative. I know of what DonJoy and DJO contribute across the global health space. So Ryan, thank you for joining us. Listeners, if you want any of the show notes or the links for anything that's been mentioned here today, you can head to clinicmastery.com/podcast. That's clinicmastery.com/podcast. You'll get all the show notes there, all the past episodes, and you can look into the options to grow your clinic through our new GMC membership or what we can help with through the Business Academy. Thank you for your earbuds today as you drive or exercise or mow the lawn. We really appreciate it, and we look forward to bringing you another episode really soon.
This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic.